Hey, everybody. Welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director for Clinical Education and Partnerships at SICA, where we partner with healthcare professionals and clinicians to offer body composition solutions. I'm so excited to be joined by a fellow dietitian, Sheena Batura, who's the Director of Clinical Programs at Salvo Health. And we're going to talk a lot about what used to be called fatty liver disease and is now metabolic liver disease and
Mhm.
some other acronyms. So I'm going to let her take us through that and tell us little bit about Salvo Health and what you do, and then dive into some of the new stuff around medications and clinical guidelines and wraparound comprehensive care in this area.
Yeah, thanks so much for having me, Nina. So Salvo Health is a digital health company that provides wraparound care services for gastroenterology practices, metabolic health practices, and essentially we are the multidisciplinary arm that services the provider with registered dietitians, licensed nurses, mental health specialists and deliver lifestyle medicine care through an in-app program and support patients on their health improvement journey.
I love that. And I love, when we started talking, I found it, really fascinating because we do see a lot of comprehensive care around the disease state of obesity, but we don't hear as much in the GI realm. So I'd love to hear even a little bit more about from the nutrition perspective, what you guys are doing because I think it's unique.
Yeah, so I think GI providers are often diagnosing metabolic liver disease. That is one place where those diagnoses are occurring. And also we know obesity care touches all specialties, and even though in the obesity realm we see it all the time, it is something that is a population effect and can be seen at all provider levels. But as far as for metabolic liver conditions, a lot of these patients are being advised to participate in lifestyle change, but also many are being prescribed GLP-1 RAs, whether that's from their GI provider or in some cases a PCP unaffiliated or necessarily connected with that GI provider. And so a lot of what we do is really in line with the ACLM, TOS, OMA, ASN guidelines in regards to lifestyle care. So, really addressing nutrition, stress, sleep, movement, behavioral change, and supporting those patients with those aspects. We all know, too, most providers have maybe 15 minutes with a patient. And so they may receive information about their diagnoses, some quick lifestyle recommendations. But really, we need to take the time with these patients to ensure they have adequate support, empathetic providers who really understand the nature of what they're going through in delivering robust, whole person centered care to support them. So, really, I think a service that is well known and established in the obesity world of having that wraparound care service, but not necessarily something we're seeing in GI or in primary care, at least everywhere. And so, it's something we hope to provide and support those physicians with.
I think that's so important, especially, given that there's a lot more virtual care happening, right? So if they're going in person to the GI, they might not need the dietitian or the, behavioral health expert in that clinic, but this way they're having access to, I mean, you're hitting all the my check marks, whole person, patient centered care, all of that, the
Mhm.
compassionate stuff. That's our world and we know that language, but it's hard to come by. Not everybody practices that way, especially these days. There's a lot of sort of top down, just people, delivering the medication, telling people
Yep.
what to do, and then like, through an education only kind of a platform. And what we know is that, it's a chronic and long term relapsing condition that requires lots of pivots and counseling and meeting the person where they're at. So I think that is really unique and something that should become less unique as it gets everywhere
Yes.
and it's more standard of care for
Agreed.
sure.
Definitely.
So yeah, so I'm glad you mentioned sort of that new set of guidelines we have because in this space it's been fun. We're seeing new stuff and new research all the time, and we love our guidelines and we love having kind of a framework for how to approach. And I know you guys are pretty well established in the ACLM world. So tell me a little bit about that. How is that sort of dictating the practice and how does that line up with what you all are doing?
Yeah, well, I think a lot of it has to do with our philosophy of lifestyle medicine care and bringing that to the masses and really ensuring, we have a very talented team of registered dietitians, for instance, who address nutrition. But I think even in obesity care and in obesity practices, we are addressing more than just the nutrition, and it has to be something that is emphasized. And so, really, as we just touched upon, the whole person approach, really ensuring that we're focused on all of those other inputs that also play into making meaningful changes is super important. And the way that we've built our product too around delivering this care is not just having regular touch points with dietitians on a monthly basis, but also having access to them outside of those monthly visits so they're able to message with their dietitian between visits, which I think is not necessarily the case for every traditional way that a dietitian's set up. But also we have in app, we've kind of broken down those key lifestyle pillars into small habits that folks can make, making it manageable, making it achievable. And there are so many habits that it can be customizable. And we know that, especially with obesity care, there's not one diet that works. There's not one approach to movement that works. And really, it's what the patient thinks works or what they want to do that matters. And so, ensuring we can customize plans, ensuring we can listen to our patients, be their coach, be their supporter, and meet them where they are is something we really put thoughtfully into our programs and our app. So we establish SMART goals with patients and really make sure that within those goals, we can break it down even further to tiny habits to help them achieve that, which I think is all what ACLM is trying to promote with kind of the robust emphasis on care that is being highlighted.
That's awesome. Yeah, and so, I mean, this year we've seen a lot of newer indications for some of the GLP-1 receptor agonists and associated medications. So, will you tell me a little bit more about sort of how that's, working in the MASH or MASL fatty liver area? I know there's a lot of new terminology, so actually help me clear that up a little bit and
Yeah.
maybe talk a little bit about the new indication and what that looks like.
Yep. So I think, I mean, the terminology has shifted, I think, because it is more inclusive of the nature of the condition. Fatty liver also, the term itself, I think carries a lot of stigma. And with us trying to, be more supportive of reducing stigma, I think metabolic conditions, metabolic liver disease is certainly a better approach to describing what actually is happening physiologically. But nevertheless, I think any new indication is good news to me where, semaglutide or other GLP-1 RAs can be used because we hope that that means more coverage for these medications and more patients can have access to them. I think that there are limited, and I'm sure colleagues, physicians, especially in this field, would agree, there are limited treatment options for MASH. So, in particular, and so having other tools to utilize is certainly of benefit for those patients who have very limited treatment options. And there's definitely more interest in fast tracking more options for those patients, but nevertheless, we appreciate a win. But I think with that means that providers who are diagnosing MASH, MASL, maybe primary care physicians, gastroenterologists, hepatologists, may find themselves also prescribing these medications. And with that comes the importance of multidisciplinary care, which may not be something that they necessarily have for a variety of reasons, not to the extent like, say, our bariatric surgeons have. And so I think with that, we continue to advocate at Salvo for the importance of having this sort of your right arm, the multidisciplinary team that really does help drive home lifestyle change and provide that support that they just simply don't have time to do, and bring the expertise needed to ensure their patients are nutritionally adequate, that they are getting the other lifestyle sort of recommendations around movement, the importance of preserving lean body mass, and all of those key areas. So I think it opens the door for more prescribing, but in turn opens the door for more advocacy around multidisciplinary care.
Totally. And that brings up a couple of things for me in what you're saying. Reminds me first of, being in the bariatric surgery world for so long. We had the occasional patient that would get referred almost like when there wasn't other treatment options. It was okay, well, we need this person to lose a significant amount of weight. And the surgery programs are robust and they're long term, and
Mhm.
it's not necessarily a pathway that everybody could embark on. So I
Yep.
do see that as like there's a gap, and that medication gap, as it is for many of the conditions, now is an option, but it also
Mhm.
does open up if they're able to prescribe, are they doing that prescribing alone, or are they doing it, with the wraparound care that we know is so
Yeah.
important? And I think for me, it's like my vision one day would be that with the prescription comes the other, it's like those two things travel together, and
Right.
body composition could be the third thing, right? You do that and it's this package deal, right? And once
Mhm.
everybody has a little bit more experience in this area, hopefully they'll be able to see that they're getting the best patient outcomes. They're getting, the best engagement and, support for their patients when they're able to add other providers and other perspectives to support, the whole person.
Right. I think too, we know that side effects can occur with these medications, and there are nutrition implications with those side effects. And certainly, dietitians, I'm not advocating for dietitians to act outside of their scope, but I think that there is some teamwork we can do in helping to mitigate some of even the dietary changes or recommendations made for those side effects. I also know physicians are very busy people, and it may help to have a team that helps to identify areas where patients do need their input. So, helping with the communication aspect of, hey, your patient identified they're experiencing nausea. Since you've increased their dose, I'm communicating this to you to help with the management, the medication management piece, and ensuring physicians are in the know about their patients because they are busy people and they don't necessarily catch everything all the time. So I think there's a communication piece that can support, and I think too emphasizing to patients sometimes it's not always clear to patients, hey, these drugs are really effective, but we're here to support you with the long-term changes and ensuring that those are instilled. We're also here to ensure you're nutritionally adequate, and it's not just eating for weight loss, it's simply eating for health and ensuring that you're staying healthy during this process, and also being a coach to you. With any change that we make to our health, there is an emotional aspect of it. And even though, there are wonderful behavioral health specialists, and that's their area to really support a lot of those key changes, I think as dietitians or as other multidisciplinary care team members, we can be an emotional support. And that's something that is needed, I think, throughout the journey the patient goes on. So
Yeah.
I think there's just a lot of reasons why multidisciplinary care is important and something that should be offered.
Absolutely. Yeah, I think, sometimes dietitians get to be that, low barrier to conversation. Like people will tell us everything and then we can sort of help
Yes,
maybe divert them when they need the expert in one of those areas. We can sort of get them there for sure. So,
exactly.
yeah,
Yep.
I love hearing that, and that's what your model is. And that it seems really like you're able to do that through the tech platform and build
Mhm,
something that's scalable, but that
mhm.
also is individualized. And I think that's the trick, right? Because a lot of programs that are just trying to scale technology
Yes.
miss that individual. And we maybe talk about AI and how that's involved too.
Yeah,
But but that piece that we know, like we've as dietitians, we've worked on the counseling part, and we know that, I mean,
right.
medication or surgery or whatever the treatment is for the long-term condition that you have, it's not always easy, and it doesn't always align with, being able to make healthy behavior changes long term. It's hard. So I think it's a nice place to be. Um, and I think it's also for me as a dietitian being able to see other fellow dietitians rising to leadership because you're now directing this team of dietitians, right? So tell me a little bit
Yeah.
about that. How is that role? And oh, I love promoting, dietitians in leadership positions. It's great.
Yeah, so I actually lead the whole care team, so the nurses, the dietitians,
Okay.
etcetera, but which is a I feel like a unique space for dietitians, and I do appreciate where what, Salvo's afforded me, but also what I've worked really hard to achieve. I think it's been a journey, certainly, and I think, when it comes to being in leadership and non-traditional pathways for dietitians, it really is about networking, right place, right time to some degree, but also showcasing your skills, showcasing why you deserve a seat at the table. So we all know why we deserve a seat at the table, but I think sometimes you have to demonstrate your value. I think a lot of my journey has been exemplifying leaders I've followed, and not necessarily all of them dietitians, but leaders who are physicians, leaders who are in medical affairs, and really just understanding what are the key traits that they had that I can emulate in a positive way to really make change in my career. And so I think those are all things that have been important to me and known to me for a while. But leading the team itself, I mean, I feel really proud to say we've built a really robust care team of really genuinely passionate people who care deeply about the patient experience at Salvo. And I think that is hard to make. I think that comes from within them, and I really am proud of the work they're doing every day to make impact. We hear very often, for instance, that patients say, I've never had access to a dietitian before. I've never had a team supporting me through this. And just providing the access, but not just the access, the true skill set of these deeply passionate individuals is really impressive to watch. So I'm super proud of the programs we've built, the team we've built, but really they're doing the work every day to ensure that our patients are served well and are making lasting changes and feeling supported. And so that's just really cool to sit back and look at as a leader. I think too, I look on the topic of tech, I just look to other leaders, I think, and really appreciate their camaraderie. So Julia at Forum, Victoria at 2030 Health, like they're both leaders that I admire and often chat with about shared experiences. And so I think learning from others in your field, even if your fields over, your companies overlap in what you do, I
Yeah.
think it's still important to share. We're all on the same mission here. We're all trying to serve patients and really ensure that they get what they need. So, and I think we all know that, and that's just been truly gratifying to get to know both of them as well.
That's right. I love, yeah, both of them. I think what they're doing in those companies is great. And I do think there's a much more expansive view these days of that, there's not one company that's going to tackle the healthcare needs of all the people who are in
Right.
this space. And so being able to, have different takes on it for, slightly different disease states or different patient populations or
Hmm.
areas of the country for sure. That's
Yep.
I love that very like both and kind of a viewpoint, not an either or.
Yep. Exactly.
Yeah. So, but I did want to ask, kind of back to the model that you guys have at Salvo Health, like what would be the pathway? So if you're a provider who's either in primary care or in, maybe a more GI specialty type of a clinic, how do they go about getting connected with you all? And what does that look like? Is it referrals and just sort of the process and flow? How does that look for you?
Well, if someone was interested, a physician or a practice, in exploring options with Salvo Health, we just know that we fully integrate with your practice. So we'll essentially have work in your EHR system. We'll be able to message you directly in there, share notes, upload notes. We help support the billing efforts as well with sort of queuing up the codes necessary for billing patients for these services. We share all of our protocols. We're very transparent about what we're doing and want, input as far as what we're doing, and if there's any adjustments or customization to those protocols, we certainly can do so. And then it's kind of a two-step process in terms of how patients are enrolled. It's either referral based, or we're also able to collect patients who have diagnoses that align with our programs by doing a data pull from the EHR system to kind of help with identifying candidates. But we definitely love when providers are speaking with their patients and knowing about us if, once we're partnered and having that conversation and explaining them what we are. Find that patients, of course, are more receptive when their physician endorses it. And so that's something that definitely we value is our physician partners providing those referrals. The one thing I would call out, because I know common questions we get or common concerns expressed that I have seen from physicians, at least in GI in particular, is, well, we'd love to have dietitians, but we tried it once and we can't get coverage. We can't make it work financially. Or dietitians we refer out, but there aren't enough of them. And what I will say is there are actually a lot of us. And I think it's somewhat of a misconception to assume that there aren't enough dietitians. Maybe just not knowing where to send your patients is really the crux of that concern. As far as coverage goes, there certainly are limitations within medical nutrition therapy or MNT in terms of what's covered. Within the obesity realm, there are the preventive codes to a degree, but with what Salvo's doing, we are billing under remote patient monitoring or RPM, which does allow for more of these services to be covered. And we've had a great degree of success, especially for chronic GI conditions, MASH mazold, obesity care, and getting it covered for patients. So we're really proud of being able to deliver these services and not just dietitians, but multidisciplinary care under the umbrella of RPM. by helping physicians with that. So all physicians, and I should also describe, receive a monthly care plan. They know exactly what their patient's doing with us. They're able to see the goals they're working on, any escalations that need to be made for worsening symptoms or any issues that the provider needs to be made aware of. We communicate in a timely manner, but we also include it in the monthly summary notes. So they are very much in the know with us versus where when they may refer out, maybe they don't get as much back in terms of knowing what's happening. But since we are basically their right arm, they're able to see exactly what we're doing on a monthly basis and sometimes more frequently.
Yeah, and helping, I mean, totally hear that. That's a question for sure. Like, what does the reimbursement look like? And how do we exactly that pathway of, oh, I tried it once and it didn't work. So that's sort of another benefit of working with someone who is expert in this area is you've
Hmm.
figured that part out and you can sort of apply that no matter where they are. So I think
Hmm.
that's a big one. And I know you and I talked a little bit earlier about kind of in the reimbursement realm, another sort of GI area outside or, in collaboration with medication is the endoscopic sleeve gastroplasty as a procedure
Hmm.
for obesity. That's kind of coming and that's, often driven by maybe a collaboration between obesity care or GI providers or maybe not. So
Hmm.
just in that space, I know we've been sort of the procedure's been around a little while. We're getting more evidence around who that might be
Hmm.
good for. Like you, I think the more options that we have in this space, the better. There was so many years where the only options were nutrition for people who, needed that.
Yep.
And now we build on that in all of the areas, but then all the way up to surgery. And so now the more medications, procedures, and options we have, I think that's really going to help the landscape. So do you have any, kind of updates on that or what's happening in that space with your GI providers?
Yeah, I think there is interest in endobariatrics from what I hear, even outside of GI, but within GI especially, there are many surgeons or endoscopists who have been doing this procedure for a while, but with the potential for, approval in the new year or it being covered versus a cash pay service only, I think it's important to highlight once again why having a multidisciplinary care team, especially with registered dietitians, is important. Again, I think we know this has been of value to bariatric surgeons, not just because insurance requires certain things, but because it's the right thing to do
Yes.
for patients, which we as clinicians value. So I think, as we have some of our partners starting to incorporate our services to support those conditions, I should say, excuse me, those procedures, we need to ensure we have the same robust care that bariatric surgeons have for these patients as they go through their postoperative journey or even preoperatively understand what implications there will be postoperatively. So I think it's key just for us to be integrated.
It's making me think too, just how the spectrum of care has just evolved in the past several years. I know you've been in the
Yeah,
field a long time too. I mean, it really was these very distinct silos of like, are you
right,
nutrition? Are you medication? Are you surgery? And like, maybe are you a procedure? And now it seems so much more fluid where all of those folks on the care team are caring for the patient, regardless of which option they're using for treatment. Um,
right.
and they know that care team. So I think you guys are in a really good position then if you're taking care of folks with a condition that needs medication, maybe a surgical option or a procedural option
Yeah.
becomes available and they can still receive that care with their trusted care team, which I think is really important.
Yep, and I think too, I mean, something to plug is myself and our chief medical officer, Hendricks, Dr. Aaron Hendricks. We're both specialists in the obesity realm, and I think that that helps bring a level of expertise that trickles down to our teams, so that when we are caring for patients who may not be coming from an obesity specialty world, we have that expertise. We can help support patients through these different avenues, different tools, and then also provide that oversight, for lack of a better term, to then give feedback loops to the physicians and inform them of things that may not always be as clear for people without so much expertise in this area. So I think that that's key when caring for patients, even if you're not with an integrative, multidisciplinary obesity care center, having that expertise can help patients who are not receiving that level of care elsewhere and helping to provide information to physicians in a meaningful way.
Absolutely. Yeah, that's good. That's good to know. I think you guys are in a really kind of fun and unique position right now to be offering this. And I'm excited to hear about all the ways that you've been able to impact the company through your, training and leadership. So we're gonna rename this the like I Love Dietitians show.
I mean,
I think I think
we're
we're able
always advocating for ourselves. I feel like, it's important. I think that nutrition has always been of interest, I think, in a public health sphere, but obviously we're hearing more and more about nutrition lately within the public discourse, not just with policies, but also with the introduction of new treatment options. And so I think it's good to highlight the good work registered dietitians are doing. I know the Academy's put out a number of position papers in this area to really emphasize the role of the RD within multidisciplinary care, but within nutrition. So I think we just have to keep reminding folks that we can make big impact. We're a member, we deserve a seat at the table, and just to keep demonstrating the good work we're doing.
absolutely. Well, thank you so much for this conversation. And what is the best way, if we want to send patients your way, how do we best look you up and stay connected?
Yeah, I would say for providers in particular, if they're interested in exploring a partnership with Salvo or just understanding more about the services, going to the website, reaching out to our partnerships team is a great first step, and we'll take it from there. My business development friends will definitely provide all the insight about what Salvo can offer.
Well, that's fantastic. And I know that we'll stay connected and see you at one of these
Yes,
upcoming meetings that we have to stay collaborative and meet with our people.
absolutely,
All
definitely.
right. Thanks so much, Sheena.
Thanks, Nina.